Hey everyone, how's it going? I'm here today with a super special patient, an 11-year-old girl who's dealing with an ingrown toenail that's starting to bother her. We're gonna take care of this with a lot of care and attention, and I'll walk you through every step of what I'm doing so you can understand exactly how this process works. So stick with me. Today, I'm working with this patient who came in with an ingrown toenail on one of her feet. This is something a lot of you might be familiar with, right? Sometimes the nail grows in a way that it presses into the skin around it, which can cause pain, redness, and sometimes even an infection if it's not caught early. She told me there's no pus yet, which is great news because it means we're catching this early. My goal is to ease her discomfort and make sure that nail grows back properly without causing any more trouble. First things first, I always start with a thorough check. I take a close look at the nail to see how it's looking, checking the color, looking for any signs of inflammation, or if the skin around it is super sensitive. Here, I can see the nail is just starting to grow into the skin, but it's in an early stage, so I'm going to work carefully to avoid any discomfort. I check in with her. Everything okay? I want her to feel comfortable and let me know if anything feels off. That's how I roll, always keeping the conversation open to make sure my patient feels safe. Before I get to work on the nail itself, I decide to remove the nail polish she's got on. Why? Because nail polish can hide the true color of the nail, and I need to see exactly what's going on. If I try to scrub it off later, it could irritate the already sensitive skin around the nail. So I tell her, I'm gonna take off the polish first, okay? Otherwise, scrubbing later might hurt. These little details make a big difference because we want to treat the issue without adding any extra discomfort. Now, as I prep her foot, I clean the area gently and start the procedure. I use sterilized podiatry specific tools to work on the nail. What I'm doing here is carefully trimming and shaping the nail to relieve the pressure on the skin. Sometimes an ingrown nail has a little edge that's digging into the skin, so I go in slowly to remove that part. While I'm working, I check in. Everything good? Can I keep going? It's so important to make sure she's feeling okay. And by the way, her foot is gorgeous. I always tell my patients that because taking care of your feet is about appreciating their natural beauty too. Once I've shaped the nail, I place a protective barrier, what I like to call a mold, to keep the area safe while I finish removing the polish. This helps me work without irritating the skin. Every step matters. After I'm done cleaning and shaping, I let her know we'll schedule a follow-up in about 2 weeks. It's not a big deal, just a quick check to make sure no little bits of skin are left behind and that the nail is growing nicely. I say to her, think you'll be back in a couple of weeks for a quick checkup? It's just a touch-up to make sure the treatment lasts and her foot stays in tip-top shape. Okay, now I want to hear from you all. Where are you watching this video from? Drop it in the comments. Are you in New York, California, Texas, or maybe somewhere totally different like overseas? I love hearing where you're tuning in from because my audience is so amazing and comes from all over. While you're at it, let me know what you think of the video or if you've ever dealt with an ingrown toenail. I read and reply to every single comment. Interacting with you all is one of the best parts of my day. Take a second to talk about foot care. A lot of people think an ingrown toenail is no big deal, but if it's not handled properly, it can turn into a bigger problem. So, here's my tip. Keep an eye on your feet, trim your nails straight across instead of rounding the edges, and if you feel any pain, don't wait, see a podiatrist. Prevention is key. Also, moisturizing your feet and wearing comfy shoes can go a long way in avoiding issues like this. Before we wrap up, I've got a big ask for you. If you enjoyed this video, please hit that like button, subscribe to the channel, and turn on the notification bell so you don't miss a thing. Here's the deal. About 90% of you watching aren't subscribed yet, and when you like, comment, or subscribe, it tells YouTube that my content is worth sharing and not some low quality stuff. That helps more people who need foot care tips find my videos. I post new videos every single day, so there's always something fresh for you to check out. And please share this video with anyone who might need it. Taking care of your feet is taking care of your health. To wrap things up, I want to leave you with this. Your feet are the foundation of your body, and taking care of them is a true act of self-love. Every step you take should feel good and pain-free. So treat your feet with the care they deserve, and remember that good health starts from the ground up. Thanks for watching, and I'll see you in the next video. Tudo bem?